अभी ये रिकॉर्डिंग भी ऑन हो गई मीटिंग की. वेलकम टू ऑल. ममता भागवत मैडम, थैंक यू वेरी मच. यू आर वेटिंग फॉर लास्ट 5 minutes. So now you can start the meeting. Manjula ma'am, Dr. Nitin, Dr. Bhagwat madam, all are welcome. Okay. तो
हाँ
मैंने
सर,
रिकॉर्डिंग भी
सर
मैंने रिकॉर्डिंग भी ऑन कर दी है नितिन जी. ओके
ठीक है सर, आपको सर अभी इनिशियल लेक्चर के लिए 2 मिनट रुके रहना है.
हाँ हाँ, मैं रुक रहा हूँ. ओके ठीक है.
And good afternoon everybody. On the behalf of Visaret Parishad, Kaichik Sambhasa Group, I welcome all of you for today's Sambhasa. As per our tradition, we will do the Dhanvantri Vandana, and I request Dr. Manjula to do the Dhanvantri Vandana.
Good afternoon, everyone. Om Namami Dhanvantarim Adidevam Surasurairvandita Pada Padmam Loke Jararubhaya Mrutyunasham Dataramisham Vividaushadhinam Dhanvantarim Ramanatam Sarvaroga Nivarakam Ayurveda Pravataram Vande Piyushadhayakam Sarve Jana Sukhino Bhavantu. Om Shanti Shanti Shanti. Hari Om.
Thank you, Dr. Manjula. We have between us our Professor Anil Shukla sir, who is the Shikshak Pramukh of Visaret Parishad, and he is the man behind all the Sambhasas and the direction of our central committee. Now I invite Professor Anil Shukla sir to please give the brief note about the concept of the Sambhasa. Professor Anil Shukla sir.
Thank you, Dr. Nitin ji. First of all, I thank central leadership of the Visaret Parishad to providing us the good platform to communicate all the stalwarts of the concerned subjects. We have started almost 14 subjects and 3 other Sambhasas like Kulguru Sambhasa and Pracharya Sambhasa along with our Anusandhan Sambhasa. So Visaret Parishad every month doing on different days the 17 Sambhasas. And out of 30 days, so there is webinar on 17 subjects, almost 1.5 hour lectures, and almost 100 to 200, sometimes 300 persons of that particular subjects are joining for this meeting, and we are getting very good response. And the main concern the faculty is facing to resolve those issues like new syllabus of the NCISM and other things. So Parishad is doing his best with help of all the stalwarts, and I thank to Manta Bhagwat madam. In the last moment, I requested her to. I knew her from last 10 years, so she is very good in her subjects and very nice person also. So I think Visaret Parishad, our national president, Professor Shukla sir, and organizing secretary Dr. Yogeshwar Mishra ji and Mahesh Vyas sir, they are all behind all these programs. So Dr. Nitin ji, I think I'm managing the back end, so don't take my much time because many people are waiting in the waiting rooms. So I'm requesting someone to admit all those who are in the waiting rooms. Dr. Nitin, please assign this duty.
Yes, sir. Dr. Manjula, admit.
Manjula, you co-host. I think it's the host in the program, na? So make someone the co-host. So the co-host should admit everybody who is in the waiting rooms. Because I will be out in waiting from 5-10 minutes. I have another meeting. Sorry, Mamta madam, I will be here a few minutes, and recording is there, so we'll hear later on. So thank you.
Dr.
Thank
Manjula,
you
can you
please carry on. No issues, sir.
Dr. Manjula, आप ऐड कर पा रहे हो? Okay, we will put it. Now I invite our Dr. Shweta Shukla, madam, from Uttarakhand Ayurvedic University in Dehradun, and she is working in the Institute Ayurvedic College, Haridwar. So please give the introduction of the Bhagavad.
A very good afternoon to all the respected dignitaries present over here. Today we all gathered here on the topic understanding of metabolic diseases in Ayurveda by Dr. Mamta Bhagwat, who is MD and PhD Kai Chikitsa. Ma'am also have degree MA and HE. Ma'am presently working as professor and head in the Department of Kaya Chikitsa at KTG Ayurvedic Medical College, Bangalore. Total teaching experience of ma'am till now is 22 years, and as a practitioner, ma'am have 25 years of experience. Ma'am worked as academic and head in charge principal at Shushruta Ayurvedic Medical College, Bangalore. Ma'am also worked as chief Ayurvedic consultant and Panchakarma specialist at Arogya Dham S. Vyasa campus, Bangalore, as consultant physician at Atre Arogya Dham, Atre Health Paradise, Bangalore, and as a consultant physician and Panchakarma expert for various clinics and hospitals in and around Bangalore. Special achievements of ma'am. Ma'am is editor and review author with FHED Trust, New Delhi, in editing of international editions of Charak Samhita. Ma'am have conducted CAR Keynotes 2017 as organizing secretary, National Seminar on Cancer. Ma'am have given talks and participated in interviews and discussions on regional TV channels, attended as a resource person, organizing member in various national and international conferences, orientation programs, and CME programs. Ma'am have participated in international workshops and seminars at Orlando, USA. As a resource person, have contributed and review author and editor for international edition of Charak Samhita, presented a paper on various topics, given a talk show on Rasayan for Longevity Jeevan Sharad Shatam, given a talk on Ayurvedic approach to neurosis. Ma'am is also a membership and awards awarded as Atur Seva Bhishak Bhushan and lifetime member of Vigyan Bharati, lifetime member of Vishwa Ayurved Parishad, Agnivesh Ayurved Anusandhan, Bangalore, and ma'am was also a state coordinator for Karnataka and committee chair of Ayurveda Short Film Festival 9th VAC Goa 2022. Ayurved Academy lifetime member, rewarded as best teacher by Student Association in 2012 and awarded as best AI rounder during BAMS. Ma'am have been recognized as academician, administrator, orator, program compere, anchor, singer, strict but student-friendly teachers, and event coordinator in the field of Ayurveda. So present today we have a so much precious teacher as a guest speaker. I think we will surely enjoy and take away from this meeting. And so I hand over to Dr. Nitin Sharma.
Yes, thank you, Dr. Sweta. By the time Dr. Mamta Bhagavat Madam will share her PPT, if we have Professor J.S. Tripathi sir or Dr. Mandeep Madam between us, Professor J.S. Tripathi sir and or Dr. Mandeep Madam from Jamnagar. I think it is the official timing of the college. They might be busy there. So, okay, I request Dr. Mamta Madam to please go ahead with her presentation.
Namaste everyone. I have started sharing my screen. Is it visible, Nitinji?
Not, madam, still.
One second. Is it visible now?
Yes, madam, it is going to. Yes, now it is visible.
Okay.
Yes, madam, it is visible now. Okay. Yes, madam, you can start.
Going to the lotus feet of Lord Dhanvantari. Om Namo Bhagavate Vasudevaya Dhanvantare Amrita Kalashahastaya Sarvamaya Vinashanaya Trailokya Shri Mahavishnave Namaha. In the beginning itself, I would like to bow my head to my gurus, my parents, my teachers, and also my students, who all have made me learn few things throughout my journey in the field of Ayurveda as well as other learning, other philosophical learning also. I'm Mamta Bhagwat. I stay in Bangalore. And I have my clinic also here. I practice in both the places, in college as well as my clinic. And for metabolic syndrome, today's topic, I have a bit of authority here because I have worked my PhD on metabolic syndrome itself. So today's topic is understanding of metabolic syndrome in Ayurveda, and the content of my today's presentation will be what is metabolic disorder, what do we mean by metabolism as such, what do we understand by the word we use metabolic syndrome, what is called ideal metabolism, then what is the contribution of lifestyle, how our lifestyle contributes in various aspects of our health, what is the understanding of Gramya Ahara that is explained in Ayurvedic classics, importance of Ahara, Vyayama, all metabolic activities being influenced by our own lifestyle, the metabolic error possible which is going to be resulted because of our lifestyle, as well as its management and different correction, various protocols we can adopt to correct our metabolic process, and then preventive measures what we can adopt to make our life much better. To say metabolism and metabolic error, if we use the word metabolism, it is the entire pakakriya that goes on in the body, a metabolic chain of reaction within a cell, outside the cell, throughout the body, starting from our oral cavity till the end product of our consumed ahara or whatever it is given inside to the body, through the any route, maybe, whether it is oral route or the anal route or injected method, whatever, what happens to that chemical is actually the metabolic process, and we refer to all those processes which go on in the body, and any variation in that normal routine process that take place happens out to be error. And metabolic disorder is wrong way of metabolism, wherein the particular pathway the metabolic activity should take place, if it is deviated, altered, or otherwise, if it is hampered by any other external sources, influences, then we call it as wrong metabolic activity or metabolic error. And for that particular activity of metabolism, there's one thing which is essential throughout, that is Agni. And entire metabolic process is Agni Vyapara itself. So the process of metabolism or metabolic activity is Agni Vyapara, and metabolic error is nothing but disorganized Agni leading to various variable kind of productions, variable kind of manifestations. That is why total metabolic error is nothing but disorganized Agni Vyapara itself. And one thing we have to understand over here, if somewhere a process is deranged, one product is produced in extra quantity, there is supposed to be another matter, another material inside the body which is lacking. So this process, Ekadesha Vriddhi and Anyasthanakshaya, will lead to variability in the doshas also. So in their regular pattern, one dhatu, one dosha increased will lead to another dhatu or another dosha decrease also. So this particular pattern will lead to another kind of manifestation, that is one dhatu or one dosha being increased and causing the variations, and another dosha or dhatu which is decreased, that is also causing disturbances in the body. So both the things have to be understood, and this leads to either santarpana of the body in by ekadesha vriddhi or vriddhi of the dosha dhatu, or otherwise if they are going into kshayavastha, it will lead to apatarpana. So the metabolic activity, if it is deranged, it leads to either santarpana vikara or apatarpana vikara. In other words, we can say this as kuposhanam, wrong method of nourishment or nutritional supplementation to the body, which will lead to various kind of abnormal manifestation. So metabolic error leads to abnormal manifestation of dosha, dhatu and mala in the body, leading to a particular disease pattern in the due course. So when we talk about this metabolic error, what happens in the body is, if it is a santarpanotta vikara or santarpana janya metabolic error, excess nourishment is happening, the person goes into unexpected weight gain or abnormal weight gain or unintended weight loss also. Failure to gain weight or a baby which is lacking in the nutritional levels. Tiredness, lack of energy, changes in the skin color, bruising easily, and thinning of the hair or thinning of the skin layer, scaling of the skin, then delayed wound healing or inflammatory processes across the body. These also can manifest. Altered circulation, vascular blocks, or respiratory issues can also be brought out because of various excessive or deficient accumulations or deficient supplementations. When these things are happening, when the body is lacking some nutrition or excessively accumulated, the body suffers with altered immune response as well as abnormal growth patterns and accumulation or depositions in the body, which may lead to various kind of disorders which will come across in the due course. Then pain, abdomen and vomiting, altered appetite, abnormal eating rhythm, developmental delays in children, all these are the possibilities when metabolic error establishes in the body. Why do we have to come across this kind of metabolic error? What happens in the body? The cause is not very specific over here. There are many causes, but a single identifiable particular cause cannot be seen. Broadly classified these metabolic errors into inherited metabolic errors or disorders and acquired metabolic disorders. The name itself is sufficient to explain them. Genetic inheritance after gene mutation in the present generation also is possible. Like for example, a parent is having a metabolic error now, which he is not inherited so far. He may pass on the genetic mutation to the next generation. So though the parents are not diabetic, the current generation may become diabetic, and later on it may pass on the genetic factor to the next generation. This is very alarming in case of these metabolic errors. If an organ is involved in metabolism, gets diseased or damaged, and it starts or gets into abnormality of functioning, like for example, pancreas or thyroid gland. Some of these metabolic disorders don't have a known cause. Particular identifiable cause may not be there. For example, type 1 diabetes or any autoimmune disorder, a specific, they put it as idiopathic or specific etiological factor not known. This is also possible in case of metabolic errors.
All others, please keep your mic on the mute.
Thank you. And if we classify these metabolic disorders, they may be of two different categories. That is, the metabolic disorders which are acquired and metabolic disorders which are genetic origin. Acquired disorders are very common nowadays, which we call under the heading of non-communicable disorders like heart diseases or obesity, type 2 diabetes, stroke, hypertension, COPD, asthma, osteoporosis, or thrombophlebitis. These are the major disorders we come across in case of NCD, non-communicable disorders or lifestyle disorders. Can I please ask?
रघुनाथ ओझा जी, प्लीज अपने को आंसर. डॉक्टर पीएन ओझा जी, डॉक्टर पीएन ओझा जी.
And in case of genetic disorders, we may not be able to do much because there is already genetic inheritance. And for that, what best we can do is avoiding the current generation to have the metabolic errors and pass on to the next generation. That is the only thing we can do. And for that, we need to correct our lifestyle because we have to avoid these metabolic errors for ourselves as well as in the future. And what is ideal metabolism? Then what if we talk about metabolism, if at all what is happening in the body is called ideal metabolism. A chemical process that takes place by converting foods or drinks into energy form throughout from till the last end product of that particular material is called as metabolism, which I already referred it as Pakakriya, and it is required for breathing, circulating blood, digesting the food, growth and repair of the cells, managing hormone levels, regulating body temperature. All these activities are under the metabolic process, and the heat generated during the metabolic process is required. The energy released during this process is also required for the normal routine work what we conduct. And for the basal metabolic activity, we need nearly about 7,100 kilocalories per day, and a woman may need 5,900 kilojoules per day, and that is the basic metabolic rate in man and woman. Then coming to the heading, what we have decided today, it is metabolic syndrome. What is metabolic syndrome? All these come under metabolic disorders, acquired metabolic disorders or acquired lifestyle disorders. Then what is metabolic syndrome? It's syndrome means cluster of many of the abnormal manifestations. We know that. And metabolic syndrome comprises of 5 major manifestations of metabolic error, and they refer to diabetes or hyperglycemia, hypertension, and then obesity, and also dyslipidemia, that is abnormal lipid levels, lipoproteins levels in the body. These comprise of the term metabolic syndrome as such. And it is also associated with it. It is not that metabolic errors happen and the person does not come across any complications. He will be just simply moving on. It is not so. the person will be having complications of these metabolic errors manifested, and that will risk him to have cardiometabolic conditions, or otherwise stroke, cancer, or autoimmunity. Any of these possibilities, even including emergencies, are possible due to metabolic errors. And the syndrome, it is not a disease itself, it is the group of abnormal conditions, clinical abnormal conditions with high blood pressure, high blood sugar, and unhealthy cholesterol levels, and abdominal fat. Abdominal fat is considered to be the major culprit for causing any of these metabolic errors and also manifesting into metabolic syndrome. And it was also called as syndrome X, insulin resistance syndrome, cardiometabolic syndrome, or dysmetabolic syndrome earlier, and so on. There are many other names also. And according to the WHO, the criteria for diagnosing these metabolic syndrome are 5. And out of these 5, if any 3 are present, also the person is diagnosed as having metabolic syndrome, and they are central obesity, then hypertriglyceridemia, particularly low levels of HDL, hyperglycemia, and hypertension. Some of the criteria also tell about urine microalbuminuria, and also they include many other lipid levels like LDL also, and particularly even uric acid levels. Increased uric acid levels are also considered for diagnostic purposes under this particular heading, but WHO has specified these 5 to be called as metabolic syndrome. What are the factors which influence our metabolic activity then? Majorly it is lifestyle and also inheritance. Then the stress, chronic diseases, long-term medications, then not undergoing Shodhana Karma as mentioned in Ayurvedic protocols, consumption of oral contraceptives, and substance abuses. Nowadays we see this abundantly, substance abuse, and then Vegadharana Prakriya, which we have learned as basic concept during our undergraduation. What is lifestyle? The way we live is lifestyle. The living conditions, behaviors, our habit, what we nurture, a typical individual's habits, then consumption of food, attitudes, taste, moral standards, economic levels, what you eat, what we, how do we sleep, how much we sleep, at what time we sleep, at what time we wake up. Everything matters in under the heading of lifestyle. Whom you come across with, the way you communicate with, what kind of business you carry out, what kind of conversation you carry out, and what kind of social relationship you have, and then what kind of professional life you have. Everything comes under lifestyle, and the list is very big. In fact, if you go on enumerating them or listing them. And what is your financial condition and what kind of stress you take for your professional, personal, or financial management, everything is under lifestyle itself. There are variable, when we talk about metabolism and lifestyle being the major influencing factor, we have to understand what is lifestyle. So I have listed out, I need to be very thankful for Google University for this. Active lifestyle, sedentary lifestyle, healthy lifestyle, solo lifestyle, rural lifestyle, urban lifestyle. There are so many kinds of lifestyle, but what influences our health is the major factor over here. Then what is ideal lifestyle? If we are sleeping at right time, waking up at right time, drinking adequate water, having no excess or no lesser food, and having a good social conduct, having good spiritual aspect, and thinking positive, thinking about Kalyanamsha, thinking about Dhanvantari Bhaga, all these are under ideal lifestyle. I don't know how many people will be following that, how many people will be able to follow that, but these are under ideal lifestyle. What is explained exactly in our Achara Rasayanam and Sadvarata is nothing but the ideal lifestyle, what we can adopt actually. But the world is going completely against to it, I know. uh, so somebody, if I mentioned about all these things, somebody was commenting Ayurveda is becoming philosophical. No, Ayurveda is philosophical. There is no Ayurveda other than philosophy. And if we talk about Satvika, being Satvika, Dharmika, being having Prasannatmendriyamana, for that, we need to be more philosophical, and lifestyle is more philosophical than practical implications. Coming to the major aspect which alters or which influences our lifestyle, that is ahara. It's told in Charaka Samhita Sutrasthana that ahara sambhavam vastuhu rogascha ahara sambhavaha. That is one important factor, what we eat, what we put in, that we become. So this factor, nowadays, what kind of ahara the people are taking is really alarming and really worrisome, because in Bangalore, what I see is in the weekends, I guess that most of the people do not cook at home. They are either in the chat centers or in the fast food centers or in the hotels, or they go for outside destinations. So this is what is the scenario we are seeing in urban area. Definitely, it is not very much altered in the rural area also nowadays because of the influence of the social media or any other factor. So the health factor is always at stake in case of when we talk about ahara. And the ahara is the most affected part. And it is mentioned in Charaka Samhita again that Dehavruto tatha aharaha tatha swapnaha sukho mataha swapna ahara samuttecha staulikarshe visheshataha. If you want to keep our body healthy, then we need to understand that we have to consume a good thing. If you want to be good, we need to consume good thing. And in what we are doing is completely a mismanagement of ahara. Naragat. We are very much attracted towards certain things. Maybe it is fast food or kind of different kind of attractions we have towards these mall, samskruti, or any of these. Then avijnanat, we don't know what is the importance of food, what we eat. Then aharan upayojayet, the person will be doing that, so we should not get lobhy towards that, and we should know what we are eating, how much we are eating, what process we are undergoing for that, what kind of samskara we are giving to ahara, everything we should know, and we have to plan for that. It is ahara yajna. We have to do it as yajna only. It is a tapas. Health maintenance is nothing but tapas. It is every day's process. And that is how we have to eat, and we can avoid ahara sambhava vyadhis. So it is our choice what kind of food we need to have, whether we need to bring harmony, a balance, or we need to come what may, I am going to eat this. This kind of the choice is definitely individuals. And we are doctors, we are Vaidyas. We have to teach them. The people who do not know, the meaning of doctor is to teach. So we have to teach them. Even if it becomes a preaching for other people, let us not make it as only preaching. Let us make it as a real teaching. We adopt it ourselves. Then tell others. So after ahara, it's about the lifestyle. So what kind of activity, vihara, we do. So if you want sthira, or if you want a stable, sturdy body, then we need to have a regular vyayama pattern, and it is Sairya Balavardhini. So we have to go for vyayama karma every day. And because of vyayama, doshakshaya, agni vruddhi, and bala vruddhi will happen. Dukkha sahishnuta, physical as well as mental, will develop. Here, what errors we commit? Avyayama. We are lazy. So we don't get up. We resort to sophistications. So all remote controlled, robot monitored, now AI controlled. So holding the book in the hands is also not required. One mobile will suffice everything. So we have become utterly lazy, and that is leading, most of the times, that is leading to avyayama of the body. Atyasana, continuous sitting. 7, 8, 9 hours a day, the people will be sitting. Maybe it is because of the profession they are in, or because of the laziness, because of being unaware about the consequence. They are doing it. And at the same time, they are taking huge mental stress, whether it is due to target orientation, or achieving the goal, a higher position, higher amount of remuneration by that, or otherwise fame, name, reaching the target place on time, the workplace on time. Everything is causing physical as well as mental stress. Wherein avyayama is there, the physical and mental tolerance is lost. At the same time, because of other reasons, physical and mental stress are happening, and we are not going for the measures which will help us to manage these things. We are not doing those things. So they are causing a lot of variations in the body. Then adhyasana or samitasana. Being unable to understand how much we eat, at what time we eat, we do adhyasana, that is even before the previous food is digested, we are going to eat, looking at the time we eat sometimes, or otherwise we eat. In order to, we have heard about anorexia nervosa or zero size figures and all. So for them, they do pramitasana and they suffer from apatarpanajanya vyadhis. And asatmya bhojana, this is very important, which will lead to a condition called leaky gut. Leaky gut is a condition very, very rarely talked about, but very important. Usually we think that in the intestine, the carbohydrate, protein, or fat, when they reach the last fructose, fatty acid and glycerol, or amino acid, they will get absorbed, and then they will get into the circulation. That is what is the understanding. Here, in case of leaky gut, these abnormal components, because they are heavy, they'll find a way escape through their intestinal area. They're becoming very heavy. They get into the circulation, and they tend to get deposited inside a vascular area. And that is how, if they are deposited in a tissue level, they cause autoimmunity. If they get deposited inside the vessel, they cause atherosclerosis and arthritis. So these are the complications they bring about. So leaky gut is very important. We are tending to eat all those things which our genes are not ready to accept. Maybe it is the Manchurians or any other stuff, the burgers, pizza, all these things which our genes are not ready to accept, but we are every now and then we are putting them in. And bhojana, as I told you, whatever, whenever, however, wherever. So this kind of bhojana is leading the Agni to get confused, and Agni will not be able to digest the things properly. Agni in various levels, not only in Jatragni level, it is Dhattvagni as well as Bhutagni level. So Kala, Samskara, Pramana and Vyavastha. We are not at all bothered. सुबह कुक कर लिया और शाम तक वही खाना चलेगा. डिब्बे में लेके जाते हैं, सुबह वही सुबह बनाया हुआ डिब्बे में लेके जाते हैं, दोपहर को वही खाते हैं, अगर बचा तो शाम को भी वही खाते हैं. ऐसे हो गया है. तो विषमासन, काल भोजन नहीं कर रहे हैं, विषमा क्वांटिटी में कर रहे हैं, विषमा संस्कार में कर रहे हैं और विषम प्रमाण में कर रहे हैं. और जो एक मुहूर्त के अंदर खाना खाना चाहिए वो हम भूल चुके हैं, वो बिल्कुल भी फॉलो नहीं हो रहा है. तो आहार का जो भी असर, रॉन्ग असर हो रहा है वो तो हो रहा है. And Nidra Vyatya, shift duties, BPO workers, and media indulgences. Nowadays, I have come across one 12-year-old girl who was saying that I cannot get sleep before 12:30. I asked why. Snapchat. That was the reason, she told. And Snapchat or WhatsApp or Instagrams, these are huge attractions the teenagers are going into, and they are causing a lot of Nidra Vyatya. And we can also say some of these multinational company workers who work for the Westerns and all, definitely their duty hours will be different from the Indian timing. So that is also influencing a lot. Nidra quantity and kala, and Nidra quality also. Everybody knows about the importance of Nidra. Nidrayatam sukham dukkam pushti kashyam balabalam vrishata klibata jnanam jivitam nacha. So that Nidra Vyatya, if good sleep is there, if good sleep is not there, we can understand. So kind of ahara which is explained in the Rasayana chapter of Charaka Samhita, the people resort to the ahara which is easily cooked, easily available, easily maintained, preserved, or refrigerated. We go for such kind of food pattern. And because of that, Acharya Charaka goes on explaining, Sarve Sharira Dosha Bhavanti Gramya Aharat. So he has explained what is Gramya Ahara in a very much, very polished way. But what we are doing is 100 times worse to that. All Sharira Dosha are caused by Gramya Ahara. Vishama Adhyashana Praya, the people who do Vishama and Adhyashana. Diva Swapna Stri Madhyanitya, Vishama Atipmatra Vyayama Sanshobhita Sharirana. So we are not following any of these Vyayama and proper Ahara, Vihara, we are not following. Bhaya, Krodha, Shoka, Lobha, Moha, Ayasa, Bahulanam. This is what is mental stress. Amla, Lavana, Katuka, Kshara, Shushka, Shaka, Mamsa, Tila, Palala, Pishta, Anna, Bhojinam. Exactly the kind of food we are eating nowadays. वो गोलगप्पे से लेके गोभी मंचूरियन पिज्जा तक वही है. Then what happens because of these ahara? They are pro-inflammatory. They cause very easily inflammatory changes in the body, and the intestinal or mucosal interface between the environment and us is totally affected. So any of these junctions are affected, the leaky gut develops, and that allows completely undigested food particles also inside to the circulation, and they cause variable kind of immune variations or depositions inside the body. And inflammasomes, one important factor is released because of this kind of leaky gut originated components in the circulation. The inflammasomes are released and they make various kind of changes in the tissue level, leading to release of inflammatory markers, maybe interleukins or cytokines or anything. And definitely these are nothing but dhatupaka which is happening, and that is why the person will be having all kind of disturbances like Nidrana, Sharadistamba, Vishtamba, Gaurava, all possibilities the person will be having. And what Acharya Charaka has told is also the same thing. Shitili bhavanti mamsani. The body factors, the thing which has to give us bala becomes shithila. Vimuchyate sandayaha. We have seen at the age of 26, 27 also they say joint pain. Osteoarthritic changes in a 31-year-old is very common. 30, 31-year-old is very common nowadays. And I have seen osteophytes developed in 32-year-old female. So what is the type of living we are doing here? Vidahyate raktam, a lot of variations, lot of even pH variation happens in the rakta. So because of that, you remember Charaka Sutrasthana 24th chapter, and all kinds of Rakta Pradosha Janya Vyadhis and Rakta Dushti Janya Vyadhis are possible here. And one among the most important among them is autoimmunity or cancer. Vishyandate nacha analpa medaha. So Meda Vishyandana, Bahu Abadha Medas, and Kleda Vriddhi. Gradually it leads to many of the metabolic disorders. One of the major manifestations is diabetes. Nasandhiyante astishu majja. So the majja related disorders, maybe it is leukemia, maybe it is sickle cell anemia, maybe it is thalassemia. Any of these disorders related to sarakta majja or majjadatu or even the mastishka majja, they are very common. Infertility rate, my God, the amount or the number of infertility cases which we are seeing now was never before. That many cases of infertility are happening. Anybody you take, out of 10 females you come across in your consultation time, out of 10, at least 7, 8 will be having either PCOD or thyroid issues. So that is what is the happening in the society, and most of them go for artificial methods of fertility. So naturally, we are making the oja to be at stake. So the person will be glayati, sidati, nidra, tandra, alasya samanvito, no enthusiasm at all for anything, for taking a task, taking up a new job, taking up a new activity, going somewhere, meeting someone. Any of these things are not, the person is not interested for. Then asamartha cheshtanam sharira manasinam, very important factor. It is not only sharirika, it is manasika also. So that is why the suicide rates or homicide rates are increasing. Any of variation in the regular happening, what I anticipate to happen, if that is not happening, the person is at rage immediately. Either they will be ready to kill themselves also. Nashta smriti buddhi chaya. So in our Bharat is very well known. The Eastern intellect is very well known for its intellectual power. Now, it is a question, are we really matching that? Roganam adhishtana bhuta, about of several diseases. Obviously, when the tissues are not good, doshas are not good, dhatus are not good, shrotas are affected, the person being affected by various kind of disorders is natural. And na sarvam ayuravapnoti, shatamanam bhavati shatayushi. This was the blessing we used to hear, and we hear now also. Are we really living to that extent? Not at all. Our life expectancy is now, it is increased a bit. It is people, WHO is saying it is 70 years, and after COVID it is reduced again. So, na sarvam ayuravapnoti, we cannot live that much as expected. And even if we live, we will be about of several diseases and we live somehow. So this is a group of disorders that come under metabolic syndrome, and the major things are mentioned over here. There are several other factors also. Then cardiac manifestations, diabetes, hypertension, vascular incompetence, atherosclerosis, deep vein thrombosis, then thrombophlebitis, inflammation and resultant disorders, tumors, cancer, autoimmunity, skin diseases, osteoarthritis, obesity, varicosity, aneurysms, hormonal disorders, infertility, what not? What else is left off? And if we say, what is the classical background for this? This is the list what we have as mentioned in Charaka Samhita under Santarpanotta Vikaras. Complications. There are several complications, and the last complication is Marana itself. So anything can happen in between, and Alzheimer's, Parkinson's disease are also predisposed by metabolic errors, which is an established factor now. Simple Google Guru presentation. And the best example we give for metabolic, because central obesity is the major culprit for causing metabolic syndrome, I have taken Sthaulya itself as an example. The causes are avyayama, divaswapna, medyanashta atibhakshana, medya, fatty diet, guru snigdha madhura ahara, more. And medovahani dushyanti varunyashta ati sevanat. So this is how the Medava Strota starts getting affected. Then Achintanat cha karyanam dhruvam santarpanena cha sapna prasangacha. So abnormal way of living he has mentioned about. So later on, what happens in case of Sthaulya, Ayusho Rasaha. First thing, the lifespan comes down because it is atimatra medasvino meda eva upachiyate na tatha itare, that only medas goes into nourishment, deposition, no other dhatus are in excellent condition. Java uparodha is the nirutsahasa. We are not active as per our body is developed. Body becomes big, but activity level comes down. The utsaha comes down, and that is because of dhatu shaithilyata, dhatu sukumarata, and gurutva. Krishna vivayata, that is because of one thing, shukra, which is reduced, as well as the medasa avrata marga, and also sharira guruta, which we should not forget. Daurbalya, because of abnormal dhatu levels. Daurgandhya, medas increased. So medas mala is sweda, the person sweats more, that is why there will be daurgandhya. Sweda abadha, excessive deposition of medas and excessive kledamsha in the medas, the person will sweat more and he will be vyayama asahishnu, and a little exertion also makes him sweat more. Kshudha atimatra and pipasa ati yoga, that is because of excessive agni which is there in the koshta, and excessive vayu which is blocked in the koshta. And it is very well mentioned in case of Sthaulya that satatam vyaditaha, he will be about of kind of disorders, whatever he can get affected with. And vikaran darunan kritva nashayanti ashu jeevitam. So his life expectancy comes very low if he becomes sthula. And it is also mentioned in Charaka Sutrasthana that sharirani atistulani avyadhi sahani. So the vyadhikshamata is also reduced. So he will be prone for infective disorders also. This is also another factor we have to remember. And what is the kind of management we can do? Nidana acts in 3 ways, which we always have to remember. Being Kaya Chikitsaka people, we need to understand what Nidana can do hazards in the body. It is dosha vruddhikara, no doubt at all. And also it is dushya daurbalyakara. It reduces the capacity or competence of the dushya, as well as it is kavaigunyakara. It brings about kavaigunya effect in the srotas also. Kavaigunya is srotovaigunya. So the person becomes prone for the disease also. So if we do any of the Nidana Sevana, it acts in 3 different levels, the 3 different categories, and the person gets easily affected. And the Bala Rasa is seen, Dhatu Bala is reduced by Nidana Sevana, and the person becomes easily prone for the diseases. That is why if we want to correct the lifestyle, treat the lifestyle disorders, begin from the correction of the lifestyle itself. In my practice also, I ask them to at what time you sleep, at what time you wake up. My management protocol starts from here. At what time you sleep, at what time you wake up. How much water you drink, and what kind of activity you do throughout the day. So a thorough history and correction of that particular thing where he is going wrong. And my management protocol starts from here, and that's how we have to observe. And because of social media and WhatsApp University, Facebook or Instagram videos and all, everybody knows everything, but nobody is following it. That is what is the problem. And everything is only in the information level. It doesn't come down in the following or knowledge level, and people are becoming masters themselves without a proper correction. So we need to educate them. We need to ask them to become regular, punctual in their activities. Anabhyasa Visham Shastram. This is what is mentioned by Chanakya. So let us not make that Shastra act as Visha in them. So let us make it as Amrita for them. The knowledge, what they have, it should turn into Amrita, not as Visha. So money and momentary pleasures, generation Gen Z or Gen Z or the current generation, what we are coming across is for this only. The momentary pleasure, momentary happening, the short-term happening is sufficient for them. They do not think long. We have to educate them for that also. Goal orientation is more important. A long-term vision is more important than momentary happening. That we have to educate them. And we have to correct Agni, Kaya Chikitsaka. So the management starts from the Agni itself, and we have to correct Agni. What we sow today is the plant tomorrow. So, Brahmi Muhurte Uttishte Swasto Rakshartam Ayusha, we have read, but introspect ourselves. If we introspect ourselves, are we ourselves really follow that? So, let us make the generation to follow this particularly. And of course, Rasayana, Nitya Rasayanas, and then always for gaining something, we have to work hard. The path of success is not short or easy. There is no shortcut for success, as Abdul Kalam ji has mentioned. So we have to, it is a tapas. Weight reduction or maintaining not to have diabetes or hypertension is a tapas. We have to do it because the world is full of various kind of attractions, and we have to protect ourselves and our family, next generation also. Our huge responsibility is there on the shoulders of Vaidya. And Shrama eva jayate. It's only efforts, it's only the personal involvement, it is only the commitment, it is only the dedication that can work out here. And I have mentioned about a lot from this slide to, see, from this slide to 3 slides, I have mentioned about what we are to do, we are supposed to do. So if we do, definitely it is Achara Rasayanam and Sadhruta only. If we are thorough with that, maybe the question of Bharat becoming the capital of diabetes, capital of non-communicable diseases would not have arisen at all. But we have forgotten it, and we have to regenerate it or revise it, or we have to make the next generation also understand it. So please avoid, this is what is the advocation given by Ayurveda. This is definitely not philosophy. This is what we are supposed to be. I was discussing about this ahara and various things with Ananta Dharmadhikari sir. And somebody asked during that time, somebody asked, sir, that, sir, आप कैसे maintain करते हो? आपको ये लालसा नहीं होता है, लोभ नहीं होता है कि थोड़ा और ज्यादा खा लूं? आप कैसे रेगुलेट करते हो? हमें तो आमचूर मिल गया तो, और आम की कुछ ऐसे मिल गया तो हम बहुत खा लेते हैं, आप कैसे मैनेज कर लेते हो? हम भी सीखना चाहते हैं। ऐसे किसी ने पूछा सर से, तो सर बोल रहे थे, किसको खाने का मन नहीं करता? मुझे भी मन करता है, मैं ऐसा करता हूँ, अगर वो ज्यादा खा लिया तो दूसरा जो है, जो मैं रेगुलर खाता हूँ, उसमें थोड़ा सा कमती कर लेता हूँ, तो बैलेंस हो जाता है. That is why sir has maintained so much, so well. From years we are seeing him, and definitely such gurus are pratasmaraniyas, and definitely we have to follow them in that way. How they live also matters, and definitely these are not philosophy, they are to be followed. So the best Shodhana karma what we can do in case of these metabolic disorders is Virechana karma, and it helps in set of disorders which come under these metabolic disorders or metabolic syndrome also. That is why I always focus, or I always ask people to go for one complete body cleansing procedure, detoxification procedure, a complete Shodhana karma, that is best indicated is Virechana. And that's how it works. When the Aushadha reaches Hridaya by Swavirya, it moves through the Dramani, through Stula Anusrotas, and it brings about Dosha Sangata Vishyandana. And also because of Agneya Guna, it disintegrates by Tikshna Guna, and that's how it starts moving downwards. The doshas which are in Viklishta Avastha, they are moving downwards, and Prithvi Jala Mahabhuta takes it downwards. And entire Srotas gets cleansed completely because of Virechana. Virechana acts complete on the entire body, and that's how Indriyas also get nourished. And I have seen, in my practice itself, I have seen people going into a complete U-turn of their lifestyle. They have corrected, and there are many patients, I don't call them patients, they were affected with hyperglycemia, and they were branded as borderline diabetics. They are without medication for years now. They do not have any medicine so far, and they are maintaining it. That is also possible if Ayurvedic way of living is observed. And this is the importance of Shodhana karma or Nitya Virechana karma. They do not allow any of the unwanted thing to be deposited or sticking onto the body, inside a vessel, or in amidst of the tissues. So it is very helpful for detoxification procedure. And as it is available information that nearly about 500 chemicals are in our body contact every day, and most of them are unwanted. The preservatives, the colors we eat, or the pesticides we eat every day is unmatched to the permissible amounts. So we have to undergo Shodhana every now and then if we don't want any toxin to be remaining in the body. And that's how it works out. So the lifestyle which is advocated in Ayurveda is also for yoga every day. So let us do yoga also for our mental as well as physical well-being. So samatvam, harmony. And this is a case presentation of the lady is of varicose veins which are deep inside, not visible outside. And she has developed this kind of abnormal skin colorations in her limbs. And this is what is her presentation. ESR was raised 45, and after taking her for Virechana with Gugulu Tiktaka Grita Snehapana, and followed by Abhaya Modaka, 5 grams was given, and she purged for about 12 times on that day, on the day of Virechana. And later on, after Samsarjana Krama was over, she was taken for Basti Karma. And this is, sorry. I hope this plays now. There is no audio.
No, ma'am.
So she's happy. She's so much happy that she wanted to express herself. She was unable to walk also. She was unable to climb 1 or 2 steps also in my clinic. And later she was able to easily walk inside, do her own routine work. And she started all household work also later on. And that's how she was happy to express it. And it was not video I volunteered for. It was the video she volunteered for. That's why I presented the same video. डॉक्टर नान हेलबोदा, she asked, मैं कह सकती हूँ क्या जो मुझे यहाँ पे महसूस हुआ है वो कह सकती हूँ क्या? ऐसे पूछ के उन्होंने जो बताया मुझे वो बहुत अच्छा लगा, इसलिए मैंने वही वीडियो रखा है यहाँ पे. वो बोल रही थी कि मेरे पैर में सूजन थे, दोनों पैरों में सूजन थे और इतना डिस्कलरेशन हो चुका था, मैं चल भी नहीं सकती थी, 2-3 स्टेप्स ऐसे चढ़ के नहीं आ सकती थी. अभी मुझे बहुत आसान हो गया है. मैंने यहाँ पे आके विरेचन करके एक ट्रीटमेंट लिया है और उसके बाद भी एक ट्रीटमेंट लिया है. that is she is explaining about Basti. She was not knowing that name particularly when she was explaining. तो उससे बहुत राहत मिला है. अभी it was June 23. So अब उनकी ट्रीटमेंट सब बंद कर दिए गए हैं और शी इज फॉलोइंग द वे ऑफ लिविंग एज एडवोकेटेड बाय आयुर्वेदा. दैट इज मोर इम्पोर्टेंट एंड शी इज वेरी हैप्पी. शी इज a resident of Bangalore itself and she is very happy now. That is why I told you Ayurvedic living lifestyle as advocated in Ayurveda can work wonders in our body, and that's how we can avoid the many of the diseases including metabolic syndrome. And there is one Upanishad version that says Jivema Sharadashatam. जिएंगे तो जिएंगे 100 years. And कैसे? पश्येम शरदशतम. हम 100 साल जी के जो होता है जिस दुनिया में वो भी देखेंगे और उसके बाद मोनाम शरदशतम. हम खुशी खुशी से जिएंगे. Let's make our life celebrative. Let us not become vegetative, let us become celebrative. So that is what is my message also for today. And I'm so much thankful to team Vishwa Ayurveda Parishad, Anil Shukla ji, and then Nitin ji. You coordinated very well. You helped me through many of the things. And also the entire team, Vishwa Ayurveda Parishad, my respected gurus, then Google Guru. I have taken some of these pictures from Google Guru, like metabolic syndrome presentation. My patients who trust me and come to me by word of mouth and all. And also some of the pictures are from World Ayurveda Foundation. I'm very much thankful for that. Those very meaningful pictures. And thank you very much. That's how I conclude today's presentation.
Yeah. I request the audience, if you have any questions, you can post it in the chat box or else you can directly ask madam. Thank you, ma'am, for the wonderful session. Waiting for the audience to please have any doubts or you want to discuss. The session is open for discussion.
Good evening, ma'am.
Please tell. Good evening.
Ma'am, it was a wonderful session. It was a very different perspective we had. We got clarity and the way of thinking was different. Okay, not taking much more time. I would like to go on Sthaulya, ma'am, the way of treating Sthaulya, because sometimes it becomes very difficult. I would like to ask you one more question regarding Sthaulya. Will consumption of Medopachak Gana be helpful in Sthaulya?
Yes, to some extent. You are
Okay.
Sneha, right?
Yes, ma'am. Myself, Vaidya Sneha. Yes,
Vaidya
ma'am.
Sneha. One thing is very much important to know that while treating Sthaulya, it is 50% from our medication, our efforts, and 50% from the person also. So we have to educate the people to be consistent in their efforts. एक दो महीना कर लेते हैं, उसके बाद थोड़ा सा लालची हो जाते हैं फिर से और खाने लगते हैं या व्यायाम बंद कर लेते हैं. ऐसा नहीं हो सकता. और जो भी 7-8 केजीज लूज किए हुए हैं वो वापस गेन कर लेते हैं. ऐसा भी नहीं होना चाहिए. तो कंसिस्टेंट एफर्ट इज रिक्वायर्ड. दैट इज व्हाई आई एम टेलिंग यू it is 50% from our side, 50% from their side. And regarding Medopachaka Gana, it is Medo Dhatvagni Mandya which is present over there for Sthaulya. So Medopachaka Gana definitely increases the Meda Dhatvagni. So that will definitely help, no doubt at all.
Ma'am, it is said that having Medopachak Gan for a too longer time will increase the burden on kidneys also. So along with that, we
See,
have
for
to.
ashwagandha also people are telling like that. For amrita also people are telling like that. Don't go by that. But any medication is a medication. It is not ahara. Medicine is a medicine. It should be consumed as a medicine, not as ahara. So we have to. There are mandala kalas. There are stipulated time pattern for any medicine to be given. So we are not advocating any medicine to be taken for years together like that. Any medicine given for a very long time definitely gives adverse effects, which we have to understand also, because medicine is medicine only. It is aushadha only, not ahara. Ahara is nitya sevaniya. Aushadha is not nitya sevaniya.
Ma'am, type 2 diabetes, is it curable?
Are you asking about diabetes or are you asking
Type,
about?
type 2, ma'am. Type 2.
Yes, if it is diabetes, how can you say it is curable? If it is prameha, definitely I would have definitely I have an answer for that. You can live without medication. I don't say it never comes back.
Thank you, ma'am.
The way we compromise definitely leads us to many of the complications. Sir, Gauri Shankar sir, namaste sir.
Namaste, madam. Namaste, madam. Namaste.
So nice to see you. My God, you are also there.
I'm hearing. And the class was very nice. And in the interpretation,
Thank you so much, sir.
your correlations, everything is fine.
That was a huge blessing to me.
Oh, it is. I mean, I am telling the truth, madam. One thing I want to clarify or your vision on this. It has been told that though you are telling about the Viruddha and all those things, and in another context in Ashtanga Hridaya, it says that Vyayama, Sniktha, Deeptagni, Vayastha, Balashalinam, Virodhyabhita Pidaye, Salmyam Akpam Cha Bhojanam. So here, the Vyayama, it's okay, as you have explained. You have never touched about this Sniktha, Vyayama, Sniktha, Deeptagni. So what is your opinion regarding that Snigdha, whether we have to avoid it all the way? And in another place, in Sushruta Samhita, Chikilsasthana 21st chapter, it says that Snehasaro ayam Purusha.
Yes.
So how to correlate all these things, and what is your opinion regarding this? This is, I mean, for a long time I have these doubts, not yet clear. I am asking from you.
Sir, I may not be able, able to clarify your doubt, but I will try to give some inputs regarding this. Snehasaro ayam purushaha is very much true, because if we consider the dhatus and the quality of the dhatus, the gunas of the dhatus, most of the dhatus are having snigdhamsha in them. And it is not the abhishandi kind of thing what it is explained over there. It is snigdhamsha. Maybe it is grita, or maybe it is kshirajanya or mamsarasajanya snigdhamsha, which is explained over there. And also it is not in excess. Grita is nitya seva.
Mamta madam, I think requesting to reach out.
क्या डॉक्टर वो निकल गई क्या ममता मैडम?
Sir, कुछ technical problem. She was removed. It was said that. Can you please call madam? Can you please call madam? She's not
नहीं
there.
पता, अगर रिमूव होंगे तो वो तुम कॉलेज में ही हो?
नहीं सर मैं निकल चुकी हूँ.
Hello. Is it possible to continue the seminar?
Sir, there's some problem. Madam was disconnected from the call.
Yes. So what to do now?
As Sir Nitin sir is contacting madam, hopefully she'll
Okay,
rejoin.
fine,
We'll
fine,
wait
fine,
for a couple of
fine,
seconds, sir.
fine,
Couple
fine,
of minutes.
fine.
Gauri Shankarji, I'm Dr. Gopal Krishna. You can just
Namaste,
give your
Gopal.
insights Namaste, Namaste ji.
Namaste.
You can just give your insights regarding this Vyayama, Sneha, all these things.
Oh,
So
fine,
because
fine.
you are working on those things, and I know in Vagbata Sarani you are doing a human service.
Fine. Okay.
Fine.
Well, I'm having, this is the thing. He has
Yes.
told Viruthas all those things, and nowadays, as Madam was specifying it, everybody used to go out for food and take food, and some other youngsters, they will be on the part of their duty, they will be having foods from hotels and all those things. There, we cannot say that we may not be able to insist them to take the correct food or and all those things. And in that time, I mean, at the same context, Vagbhadacharya says about this thing, Vyayama, Sniktha, Deeptagni, Vayastha, Belasharinam, Virodhya Vinabedai, Salmyam, Alpam Chapojanam. See it. So she was explaining about Vyayama, Deeptagni, Vayastha, Bela, etc., excluding the Sniktha. That's why I was specifying about this Sniktha. And as Susuda, 21st chapter, Chikitsa Snehasarayam Purusha. Here, the thing is, daily we have to take some amount of Sniktha where it will not be crossing the limits of Snikthamsha in our body. That much we can take, and till then, that will be helping for our day-to-day activities as well as the metabolism in a clear way. So those things will be happening. So there should be a limit. That is what I want to express. Just like you see here, we are in modern science, we are having BMI, body mass index, like something like that. We have to make it ourselves, and we can go for practice all those things. That is my idea regarding this. This is what I want to express in my word. Okay, madam has joined. Now let us hear from madam.
Yes,
Mamta
yes, yes.
madam. Yes, madam.
Sir, um,
Yes, madam.
Snehamayam Purushaha is very true, sir. So Snigdhamsha is from Grita or Kshira kind of things, and Mamsarasa, such kind of Nitya Sevaniya Dravyas. And it is not excess Snigdhamsha which is mentioned. In case of Staulya, it is Atisnehat. It is the consumption of Atisneha Dravya and in excess quantity as well. So which is not supposed to be done. So, while explaining Staulya Samprapti, also Acharya Sushruta says it is Atisnehat Atigurutvat Shariram Anukraman Medaiva Upachiyate Na Tatha Itare Dhatavaha, and it gets deposited also, he says. So, Atisnehat, he uses the word Atisnehat itself. So that we have to understand. Snigdhamsha is required for all the dhatus. And Kapha dosha is a bala in the body, and it is majorly of Snigdhamsha itself. So Snigdhamsha is definitely a major component in the body to bring shlesha, or to bring the compactness of the dhatus or the cells or any of these components, ashayas, kalas, everything. Snigdhamsha is required, no doubt, but excessive Snigdhamsha could be dangerous, which the people are undergoing, and that leads to Staulya, not the regular Snigdhamsha a person is supposed to be taking. This is one point.
Ma'am, that was the question. What is that excess means? What is the limit? That was what specifically sir wanted to ask.
Nobody has specified that limit this much. See, one calculation is there in the modern medical science, that how much calorie expenditure is there in the body, that much calorie intake is advocated. So how much calorie we are utilizing by our activities, by our viharas or the vyayama we do, that much calorie intake is, this calculation is there. Whether it is 7,100 kilocalories per day or 5,900 kilojoules per day, whatever it is, but this kind of calculation is available in the modern medical science, but it is person to person variable, purusham vikshya in Ayurveda. So what is your prakriti, what is your level of type of vihara you are doing, and what is your dosha vriddhi avastha? So snigdhamsha is calculated according to that. It is not specified in a particular quantity, and it cannot be generalized also. It is individualistic. Purusham Viksha is the mantra over here.
Yeah, keeping in the mind the Satme concept, because a team and particular duration of time which is taken for certain period may get Satma. So that has to cross that line also, then only it is capable of causing the Vikara. That is what, yeah, very nicely explained, ma'am. Thank you. Any other questions?
And when we say Satmya, many things become Satmya. Even a coffee can become Satmya, but coffee is not at all an advocable ingredient. And we hear from our patients that एक coffee cup के बिना कुछ होता ही नहीं है, दिन शुरू नहीं होता है, स्रोतस नहीं खुलते हैं. I have heard Ayurvedic doctors also telling मेरे स्रोतस खुलते ही नहीं है एक कप चाय के बिना. So this is also Satmya only. Yoga Satmya has been developed in people, but this need not be hita satmya. So what is required to the body? What is my consumption? What is utilization? This has to be calculated by the individual itself, and accordingly we have to go. And this may vary according to the age also.
This addiction is very difficult to counsel and convince the patient, ma'am.
Absolutely, very difficult. And while doing snehapana or amapachana avastha itself, we start withdrawing or weaning them from that kind of addiction. And still people say on first day, second day of snehapana, subah coffee nahi piya na doctor, itna headache ho raha hai. So this is what we hear from people. They have lived like that or many years, and suddenly a sudden withdrawal may not be possible, but it is possible to withdraw completely. And coffee and tea could be a very mild substance abuse. Very mild substance abuse, though they are not considered under abusive substances. But think about the major substance abuses we are coming across now. I have come across a woman 3 months pregnant, and she was asking me, is there any way to quit smoking? A 3-month pregnant woman asking me for quitting smoking. And this is what is the substance abuse we are seeing, and the hazardous effects we see, what kind of changes it can bring in our body. So we are in that particular era.
Manasik swasthya is very important nowadays, ma'am, because of that.
Absolutely.
Yes.
Madam,
Sharirik Manasatma is very important.
Madam, I am Dr. Harshavardhan from Ayurveda College, Tirupati. Madam, as far as the concern regarding the thyroid and Madhumeha, the line of approaches of, especially in Panchakarma, how we can interpret, madam?
Both are kapha pradhana, right?
Yes, madam.
If we are talking about hypothyroidism, both are kapha pradhana, and definitely we have to go in that line. And in that, if at all he is affected by prameha, we have to see for inheritance also, and that definitely makes a lot of difference. So before assuring anybody this is going to be 100% beneficial, we have to be very careful, and we have to be thinking about all these in line, and then we have to assure. We may be otherwise put in a difficult situation.
Yes. But in thyroid, so many of the cases, what we are seeing, especially if it is Snehapana we are giving, and afterwards any Shodhana giving, it is mild to moderate only we are getting. It's not much impact of the symptomatology.
Obviously, sir, if any disease goes into Bhedavastha, it is going to be having Upadravas. Whether it is thyroid or diabetes or anything, If it is going into Bedavastha, it goes into Upadravavastha, and we have to take care of those Upadravas also. Then reversal may not be possible. That is what is the Bedavastha.
Yes, yes.
Yeah. So
But in
at
diabetes,
that time, it is going to be difficult.
if the complications arises, then we are seeing the market improvement, madam. If it is a complications arises there, if you apply any Raktamokshana or any Panchakarma treatments, we are getting results. But as far as the sugar levels concerned, how we can manage with our medication, especially the diabetes, metabolic syndromes, because nowadays sedentarily it is a slow poisoning effect towards the youth, and so many of lifestyle
It
disorders
is in hyperglycemia level.
Yes.
Definitely we can reverse it. And if by correcting their lifestyle, we can make them live without medication. And we have to understand this tagline, that is by correcting their lifestyle. This is essential. If they are compromised with their lifestyle, definitely we can't assure them at all. So we have to be very careful, and regular monitoring is required. I have one person who is a vice president of a very big MNC, who has been weighing around 96 kgs and who was pre-diabetic, and he was diagnosed with pre-diabetic. His what is that? HbA1c was also 6.3, and it's been now 7 years that he is not under any medication. Once in a while he comes for and takes Shiva Gulika, and at least 3 times he has undergone Shodhana Karma, and so far no medication particularly for diabetes he is on. So these kind of cases are there, but always regular monitoring
almost we are getting good results, madam. As you said, pre-diabetic
correction is required.
Correctly speaking, if we are giving minimal Shodhana and giving any of the medication, matter of 5 or 6 months, it is so prompt. But the once long-standing of insulin dependent,
yes,
then only we are seeing because most of the people right now, they are coming to our alternative system and they want to switch it off from the from the beginning itself. But what the medications, our medications is producing insulin much as compared to the modern, that is the questionable things.
Yes,
Namaste.
many
Namaste.
research are required for that.
Namaste. Namaste, madam.
Thank you, madam, for sharing your
And
thoughts.
Harsha also, one thing I want to clarify from the
Sir.
text background about this Bhedavastha. Bhedavastha doesn't mean that it is having Ubadravas. Bheda means Bheda with respect to dosha, whether it is Vadiga, Paitiga, Kabhaja or Samsargaja or Sannivadja.
Yes.
There, Ubadravas will not be there. Ubhadrava is the next stage, as we are seeing. So textually speaking, Bheda means only Bheda with respect to dosha, whether it is Vadiga, Pittaja, Kabhaja, Samsargaja or Sannivadaja. I want to clarify in this
Definitely,
context.
sir, because all the Vataja condition, I think it may be all the complication area, we cannot touch the patient.
Yes.
Where the starting are kapha, as madam said, kapha dominant conditions, we may deal some little bit, and where we can manage up to somewhat in Pittaja condition, where Hastimeha and Haridrameha is there. But Ayurvedic parameters wise, how we should be deal with our symptomatology and with our medication, and if we are protocol, because all the Nidanas, which is not at all explained very much in modern, Anupa, Ahara and Dadi, Buddha, all the things was mentioned in our Shastra. Because if we are condoning of all those things and leading a proper Ayurvedic lifestyle, and as madam said, pre-diabetic and at least starting diabetes since 5 or 6 months, we may deal. So for that, government has give any project and allotted some doctors. It is highly appreciated right now. That is the major burning problem, is one of the metabolic disorder, which is around 10
Any other
patients.
questions are there, Nitinji?
Thank you.
Dr. Manjula, any
Yes,
other
madam. Yes,
questions?
madam.
there?
No any questions in the chat box.
Okay, madam. I think you have to leave for the clinics and all. Anyway, thank you very much for everyone for your good discussion we have, and that is the fruitfulness of the Sambhasa concept, that all of the professors, teachers, faculty members, practitioners coming together and discussing after the lecture, and the question answer session actually make it more fruitful. And
I
it is
personally would like to thank Gauri Shankar sir, Gopal Krishna sir who joined, and Anish Shukla ji who has communicated to me and made me join over here. It has been Ashwini Bhargav sir who made me join Vishwa Ayurved Parishad during 2016 in Kolkata. So I became a member of VAP in Kolkata. So that was a very memorable moment we had.
we have also joined. Dr. Suren Chaudhary sir has also joined. He is also the pioneer of the central team
Namaskar,
of the
sir.
Visakhapatnam Center. He is from America, I think, from the foreign
No,
land.
I'm in Australia and it is 9:15 in the night.
Thank you,
Oh,
sir.
And
you are much
namaskar to
ahead,
all.
sir.
Yes, it is 4.5 hour advance.
Yes, sir.
Now I invite our Dr. Shraddha Sarma Madam from Madhya Pradesh for the official vote of thanks.
Okay, thank you, Dr. Nitin. First of all, I am thankful to Dr. Mamta Bhagat, HOD KT, HOD Kaya Chikitsa, KTG Ayurvedic Medical College, Bangalore, for giving such a nice lecture. Ma'am, you have explained your presentation in systemic manner that how Agni affects metabolism and entire process of Agni Vyapar, factor responsible for metabolic disorders, types of metabolic disorders like diabetes, hypertension, heart disease. Then line of treatment, you have explained very well that how metabolic disorders, the management of metabolic disorders, and which includes Sodhan and Saman therapy. Definitely, it is beneficial for all of us in our daily clinical practice. Thanks a lot, madam, for your nice presentation. You have also shown case presentation of Virechan in varicose vein. I am also thankful for organizing committee for such a nice program. My special thanks to Dr. Yogesh Mishra sir, organizing secretary. I am also thankful to Dr. Govind Sukla sir, president, and also thankful for Professor Mahesh Vyas sir, general secretary, Professor J.S. Tripathi sir, Professor Dr. Anil Sukla sir, Dr. Prabhunath sir, coordinator, and Dr. Nitin Sarma, coordinator for this program. Thanks to all of you for organizing this program. Really, it is beneficial for all of us in our clinical practice.
Dr. Mamta Madam, many of our participants are asking for the PPT. If you are comfortable, then you are also in the Vishwa Ayurveda Parishad Kaichika Sambhasa group. You can share if you want.
Okay, sure.
Now we will do the Santi part. All will sit straight. Om Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Badhyani Pasyantu, Ma Kasyid Dukh Bhag Bhavet. Om Santi, Santi, Santi. Thank you all for joining.
Shall we leave?
Yes, madam. Thank you, Chaudhary sir, for joining. We're giving the blessings from Australia.
Thank you. Thank you. Anyone who is the host, they can end the meeting. So the recording will be terminated automatically.
End कर देती हूँ sir.